Hi everyone. Welcome to today's education on gout. My name is Evelyn, and I'll be going or explaining over to you how gout affects the immune system, some signs and symptoms to monitor, and then some intervention help manage this condition. So gout, also known as gouty arthritis, is the most common inflammatory arthritis and has a prominent rate of greater than 3%. Since gout is directly related to uric acid level in the blood, these risk factors are primarily associated with the production and then the excretion of the uric acid. Gout attack can only happen if there is a uric acid crystal within the joint, which only occurs if there is too much uric acid in the bloodstream. Occasionally, the immune system will attempt to eliminate the crystal once they are within the joint. But the white blood cells, which is the component of our immune system, may occasionally go from circulating into the joint containing the uric acid. The uric acid would be targeted for destruction by the white blood cells. That's a neutrophil, which the neutrophil will proliferate or to eliminate the crystal, causing damage to the joint to become inflamed or swollen, red, or maybe painful. And this is something we call a gout attack. And after a few days of having the gout attack, then the neutrophil becomes insufficient or insufficiently powerful to remove this uric acid crystal from the joint. And however, if the steps are not made to diminish the uric acid in the joint, they will stay. They will stay, and then the person will become high risk of experiencing another gout episode. So these are some of the signs, like severe joint pain, especially to the great toe. That could be very painful when touched or moved. The pain could be excruciating and may be accompanied by even fever. Redness, swelling, or warm to touch by the affected joint. Appearance of the top heel, that's deposit of sodium urate crystal under the skin. So there are some interventions the nurse could do to manage that. Pain management, where the nurse will administer a prescribed medication like corticosteroid or to focus the pain and then to reduce the inflammation, and also encourage the patient to rest and elevate the affected joint to minimize stress and also pain, and also applying ice pack to the affected joint to reduce the swelling and then pain. Secondly, will be dietary modification, whereby the nurse will advise to avoid high purine food like organ meat, red meat, shellfish, even alcohol. And then even encourage weight loss, since obese could be a factor for gout, and also advise a patient to drink more water to prevent, since this helps flush away the uric acid from the kidney. And also the last one would be patient's education on the causes, the symptoms, and the management. This helps to create an awareness so it prevents diseases or this complication from progressing. And then the nurse will also explain the purpose and the reason why the medication needs to be taken correctly to the patient, so the patient will not have a complication with it, with her body. So I think this is it for now. If there is any question or suggest any concern, yeah, this is the time. Okay, no concern. Okay, so thank you for your time and then your patience, and goodbye everyone. Bye.